Today, I will be presenting a psychological case study on the fictional character Elliot Alderson from the TV series Mr. Robot. Elliot is a cybersecurity engineer and hacker who struggles with significant mental health challenges. For this case study, I focused on two disorders that best explain his behavior: social anxiety disorder and major depressive disorder. First, I will briefly discuss Elliot's psychosocial history. Elliot works at a cybersecurity company called Allsafe. Although he is extremely intelligent and skilled with technology, he lives a very isolated life. Much of his time is spent alone, either working, hacking people he believes are unethical, or staying in his apartment. He struggled to maintain relationships and often feels disconnected from the people around him. Looking at Elliot's childhood helps to explain some of these challenges. His father died when he was young, which had a strong emotional impact on him. His relationship with his mother is portrayed as distant and harsh, which may have contributed to his distrust of others and difficulty forming close relationships. As an adult, Elliot's social circle is very small. His closest connection is Angela Moss, which is a childhood friend, but even with her, he often appears emotionally withdrawn. In most situations, Elliot avoids eye contact, he gives short responses, and seems uncomfortable interacting with others. These patterns of isolation and social discomfort represent his main psychological struggles. Next, I will discuss the diagnostic impression. Based on his behavior, Elliot shows strong symptoms of social anxiety disorder. According to abnormal psychology, social anxiety disorder involves a persistent fear of social situations in which a person may be judged or evaluated by others. Because of this fear, individuals often avoid social interactions. Several scenes in the show demonstrate these symptoms, like in the first episode where Elliot explains through his narration that he struggles to connect with people. When interacting with coworkers at Allsafe, he avoids eye contact and appears anxious during conversations. For example, during meetings with his boss Gideon, Elliot speaks very little and appears uncomfortable being the focus of attention. Another example occurs in crowded social settings such as bars or social gatherings. Elliot often appears overwhelmed and he withdraws from interaction. Instead of communicating directly with people, he frequently observes them through hacking their digital lives, which reflects avoidance of normal social relationships. Elliot also shows symptoms of major depressive disorder. According to the textbook, Calmer's textbook, depression involves persistent sadness, feelings of emptiness, social withdrawal, and negative thinking patterns. Throughout the series, Elliot frequently expresses feelings of loneliness and emotional disconnection from society. In several scenes, he sits alone in his apartment describing how empty he feels. His narration often includes pessimistic thoughts about the world and about himself. Elliot also uses substances such as morphine to cope with emotional distress. These behaviors are consistent with the depressive symptoms described in the textbook. When considering differential diagnosis, other disorders could potentially explain some of Elliot's symptoms. One being avoidant personality disorder, and the other being post-traumatic stress disorder. Post-traumatic stress disorder is shown in Elliot when he experiences since he experienced childhood trauma and loss. However, his symptoms most consistently align with social anxiety disorder and major depressive disorder. Sorry, I lost my train of thought. Finally, I will discuss a possible treatment plan. So a helpful treatment plan for Elliot would be CBT, which is cognitive behavioral therapy, which focuses on identifying and changing negative thought patterns that contribute to anxiety and depression. Elliot often assumes that people cannot be trusted and social interactions will end negatively. CBT could help him recognize these automatic thoughts and replace them with more balanced thinking. Therapy could also involve gradual exposure to social situations, so Elliot could slowly build confidence interacting with others. There's also medications, which are SSRIs. It can help reduce the symptoms of depression and social anxiety by stabilizing mood and decreasing anxiety. In conclusion, Elliot Alderson provides a strong fictional example of how social anxiety and depression can affect a person's daily life and relationships. His character demonstrates how trauma, isolation, and negative thinking patterns can contribute to mental health disorders. With appropriate treatment and individuals experiencing similar symptoms could learn healthier coping strategies and improve their quality of life. Thank you.